Hi, my name is Lilybeth Lugo and I'm one of the audiologists at Lovelace ENT and Hearing Center, and I have prepared a small presentation on hearing loss for you today. In today's presentation, we're going to talk about what is hearing loss, types and causes of hearing loss, some common signs, and at the end, we're going to mention some treatment options for hearing loss. Hearing loss is the partial or total inability to hear sound when any part of the ear, the vestibulocochlear nerve, or auditory system are not working properly. This could happen in one or both ears. Different levels of hearing loss are referred to as degrees, depending on the severity of hearing loss, and can vary from a mild to a profound hearing loss. In a study conducted by Johns Hopkins, they explored how common hearing loss is at different ages and found that the percentage of people with hearing loss approximately doubles with every decade of life. As such, hearing loss is much more common among older adults, and 91% of adults with hearing loss are aged 50 and older. We can see in this image how the percentage of hearing loss doubles with every decade of life. If we look here, we will see that 1 in 10 individuals between 50 to 59 years old will have some degree of hearing loss, compared to 8 in 10 individuals that are 80 years or older. They also found that hearing loss is more common in males than females. Adult men in their 50s are 3 times as likely to have hearing loss than women of the same age. But as the age, hearing loss rates become similar among the sexes. Now, let's review the anatomy of the ear. Your ear can be divided into 3 main parts. These are the outer ear, the middle ear, and the inner ear. The outer ear consists of your ear and the ear canal. The eardrum separates your outer ear from your middle ear. In the middle ear, you will be able to see the ossicles and the eustachian tube. The outer ear and middle ear help collect and amplify sounds, and they will send them to your inner ear. In the inner ear, you will be able to see the cochlea that plays a role in hearing, and the semicircular canals. The inner ear converts sound waves to messages that are sent to the brain. The inner ear also senses the movement and positions of your head and body, and it helps you maintain your balance and see clearly even when you change positions. Now, let's review the different types of hearing loss. First, let's talk about conductive hearing loss. Conductive hearing loss can happen anytime something prevents sounds from getting across the outer and middle ear. Sensorineural hearing loss happens when the inner ear or the actual hearing nerve itself becomes damaged. Mixed hearing loss is a combination of both sensorineural and conductive hearing loss. And what can cause hearing loss? If we look at the first part of the slide, we can see that the gradual buildup of earwax, ear infections, or fluid in the middle ear could cause hearing loss. Loud blast of noise, sudden changes in pressure, poking your eardrum with an object, and infections can cause your eardrum to rupture and affect your hearing. These are just a few cases of conductive hearing loss in where your outer or middle ear are affected and sounds can get through the inner ear. If we find any of these issues, medical treatment will help with your hearing loss symptoms. On the other hand, if we look in the other side of the slide, we will see that loud noise exposure, aging, acoustic tumors, ototoxic drugs that are medications that affect your inner ear, and viral infections might cause permanent damage to your inner ear. And all of these are examples of sensorineural hearing loss. If we see a combination of both, then we will see a mixed hearing loss. And for adults with any kind of hearing loss, these are all good indicators that you might not be hearing as well as you used to. You might experience all or just a few of these scenarios. Difficulty following conversations with 2 or more people. If you have any issues hearing someone because of background noise. If you can't understand women and or children's voices. And also if you think that others seem to mumble. If you often ask people to repeat what they're saying, and if you need to turn up the TV volume. having trouble to hear over the phone, and reading lips when others speak to you are some of the indicators that you have some degree of hearing loss. Signs and symptoms of hearing loss: ringing in the ears, or tinnitus. The CDC estimates that nearly 50% of the general public experience some form of tinnitus. That indicates that more than 80% of the patients who have tinnitus also have some degree of hearing loss. Ear pain is another symptom. Persistent ear infections, dizziness or vertigo, and sudden hearing loss. Sudden hearing loss is considered a medical emergency. A lot of people believe that they just have some wax buildup or any fluid behind their ears, and they don't pay attention to this, but it is really important to seek medical advice for this and medical treatment. Let's talk about a few conditions that have been linked to hearing loss over the years. The first one is social isolation. Age-related hearing loss, or presbycusis, affects the auditory processing of sounds by the cochlea. This impairs the ability to comprehend auditory information, making conversations more difficult to follow, which can lead to frustration and to avoid potentially embarrassing social situations, like noisy environments or large groups. And different studies have shown that for every 10 dB drop in hearing sensitivity, the odds of social isolation among 60 to 69 years old increased by 52%. Hearing loss also increases the risk of falls. A study conducted by Lin and colleagues in 2012 found that a mild degree of hearing loss triples the risk of accidental fall. This risk increases by 140% for every additional 10 decibels of hearing loss. But how does hearing loss affect your balance? Well, hearing loss makes people less aware of their environment, so they don't notice other people, pets, or activities going on around them. Hearing loss also can decrease spatial awareness, so being able to gauge where the body is in relation to objects around them gets trickier. And hearing loss can cause the brain to use more resources for hearing and interpreting speech and sound, so fewer resources go towards gait or balance. These factors can all make patients with hearing loss more likely to lose their balance and fall. Vascular disorders could be linked to hearing loss. The relationship between heart disease and hearing loss has been studied over the years. While there is not a direct causal link between heart disease and hearing loss, there is a large body of evidence suggesting a relationship between the two. It is believed that cardiovascular disorders can reduce blood flow to the ear and in turn cause damage to different parts of the auditory system, causing sensorineural hearing loss. And how is diabetes connected or linked with hearing loss? Well, high blood sugar levels could damage small blood vessels and nerves in the inner ear, and on the other hand, low blood sugar could damage how the nerve signals travel from the inner ear to your brain, and both types of nerve damage can lead to hearing loss. In a study conducted by Hoffman and colleagues, they found that hearing loss is twice as common in people who have diabetes as it is in people of the same age who don't have diabetes. Kidney disease is associated with a 43% of increased risk of hearing loss. And what is the link between the two? Well, the kidney and the inner ear share similar structures and functions. And medications that are used to treat kidney disease could affect our inner ear and cause hearing loss. Hearing loss and dementia. Researchers don't know for sure how the two conditions are connected, but a study conducted by Frank and colleagues found that a mild degree of hearing loss could double the risk of dementia. A moderate loss tripled the risk, and people with a severe hearing loss are 5 times more likely to develop dementia. This is why hearing loss is estimated to account for about 8% of dementia cases. How are these two conditions connected? Well, there's a few theories about that. People with hearing loss tend to feel isolated because it's hard to join in conversations or be social with others when you can't hear. The brain must work harder to process sound. If your ears can no longer pick up as many sounds, your hearing nerve will send fewer signals to your brain. When the hearing section of your brain grows inactive, it results in tissue loss and changes in brain structure. As a result, the brain declines. And now we have talked about what is hearing loss, cause and types of hearing loss, and different conditions that have been linked to hearing loss. But what are our treatment options? Well, it's really important to know that hearing problems that are ignored or untreated can get worse with time. That is why I would recommend that if you notice any changes in your hearing, just seek medical attention. Treatment could be as easy as an ear cleaning because you have some wax buildup, or it can be more complex and require surgeries or different kind of medications to treat it. It will all depend on the type of hearing loss that you have. If you have sensory nerve hearing loss, which is more of a permanent damage to your inner ear, we will recommend hearing aids, and they will look really similar to the ones that you see in the first picture. Normally they will go behind your ear and they will amplify sounds that are going on around you so that you can hear better. We also have different types of implantable devices like the cochlear implants and bone anchored hearing aids or BAHAs. These ones, the ear, nose and throat doctors and an audiologist will recommend it depending on the type of hearing loss that you have and other indications. So that will be all for today's presentation. Thank you so much for your attention today.